Hi, this is a video on how to perform the weekly DLCO check and the monthly DLCO linearity check according to ATS. We'll be using a Ventus 1 PFT system. This procedure is the same on any Ventus 1 series system, so a Ventus 1, a 1 PFT, or 1DL, as well as for a Ventus body. We'll discuss the hardware setup and equipment that's needed, as well as the software setup, and then we'll demonstrate the procedure itself. I'm holding the QM syringe 3 liter with ventilator. It's a 3 liter syringe. It has a fan built inside to mix the gases. It also has a button on the knob that whenever you press it during the breath hold time, it actuates the fan to mix the gas. And it also has this jumper that will slide to different positions. There's a 3 liter, a 2 liter, and then even a 1 liter position. We're going to use the 3 liter position and the 2 liter position for these tests. This is not the same as a regular calibration syringe. This 3 liter syringe is called a QM syringe 3 liter with ventilator. It may be called on the label JQM syringe. Those are the same devices, but it has the button and fan and motor to mix the gas, as well as the jumper button. It has batteries, as well as a restrictor valve to control our speed during this test. So you need this syringe. We need to make sure it has good batteries, so you can press the button and put your ear up to it and you can hear the fan going. Or if you have the microguard filter off, you actually can look inside and see the fan moving. We want to make sure our batteries are in a good state. We also need to have our Ventus system fully calibrated before using this, as well as make sure your gases are turned on, in particular your diffusion gas. So to do this, we will be connecting this to the USS sensor and performing strokes with the syringe, breathing on the system with the syringe. In place of a human breathing on it, the syringe is going to be doing that part of the test, and this is a mechanical model test. So let's show you the setup in the software. So we will need to pull up a Sentry Suite Quality Management patient that are pre-built into the system. So go to Search, Patient Type, SESQM Validation, and click Search. We're going to choose the 3 liter SESQM 3 liter patient and click Select. And then we're going to navigate, after starting a new visit, to the Diffusion SB Real-Time Measurement Program. So once we have the SESQM patient pulled up, we just access the diffusion program. You also want to check one program setting. So you're going to, as it's warming up here, or the analyzers are getting prepared, click on Settings and Program Settings. And we want to confirm that this is set at 0 and 200. For the mixing pump, dead space should be at 200. Your system will probably come that way, but if you see different numbers, change this to 0 and 200 and click OK. And you can say Yes, Save to Template. And then our software is ready. So I'm already set up. ATS says that they want you to do this weekly at the 3 liter mark, and then monthly at the 2 liter mark. And so I'm going to show you the 3 liter test first. All I got to do is hit F1. I'm going to let this 0, and then I will connect the syringe to my ultrasonic sensor. I like to press in and twist slightly so that there is a good connection at the USS. And then I'm going to perform tidal volume strokes, slow and regular pace, full 3 liters, and just continue until you get the red line. When it's time to fully exhale, I can leave my handle extended. I'm going to reach over and hit F1 on the keyboard, or you can have a colleague do that. And then I'm going to exhale the gas and then inhale 3 liters of test gas. I'm now pressing the button down on the knob and holding it down during the extended breath hold time. And at the end of the breath hold time, I'm going to push the handle back in and exhale all 3 liters out of the syringe. I can pull some air back in to clean good air in through the system. That's the 3 liter DLCO check. And the values we're looking for on the table are the DLCO parameter For the CO gas, no carbon monoxide should have diffused, and so our result should be 0. And ATS said it should be less than 0.5. ATS also says your alveolar volume should be close to 3 liters within 300 milliliters of that 3 liter mark. So 2.7 to 3.3 is your specification, and we are in that range. Now, you would do this each week. And then on the 4th week or monthly, after doing the 3 liter, you're going to move this to the 2 liter jumper spot. I'm going to also pull up a 2 liter patient so my values line up. So SESQM, hit search. Now I'm going to go to my 2 liter patient and add a new visit. And now we're going to perform this at the 2 liter mark. Before we do subsequent measurements, either additional 3 liter measurements or now jumping to the 2 liter, we want to make sure that we pump the syringe when it's disconnected from the system up to 10 times to make sure that we have cleaned out any DLCO gas that's remaining in the syringe or filter. Okay, so that now that we have cleaned this out, I'm going to set my jumper to the 2 liter location. I'm going to hit F1 to start the next test. And this is going to show linearity of my analyzers, having done it at 3 liters and now at 2 liters. So I'm going to attach this again, make sure that your connection is secure. And now I am performing tidal volumes that are just 2 liters in size. Again, kind of regular pace, nice and rhythmic. Don't get rushed here. Keep going until you get the red line. Leave your handle extended, press F1. Now we're going to simulate the exhale, and then we're going to inhale 2 liters of test gas and press the button at the end. So now I'm holding the knob, but I also have to move this jumper now back to the 3 liter mark so that when my breath hold time is finished, I can exhale all 3 liters. Okay, so I notice I pushed the handle all the way in, cleared all of the gas out of the syringe. I can pull some air back through, disconnect. And now I'm looking for the same results up in the table. The DLCO should be less than 0.5, and it's close to that, close to 0. And my VA should be within 2.7 to 3.3, close to my 3 liters as it checks your alveolar volume from your CH4 gas. And that is the DLCO weekly check and the monthly DLCO linearity check using the QM syringe 3 liter with ventilator for Jaeger Medical.